This is our workstation where the providers and the nurses sit together, discuss patients and what they're going to do next, orders, things like that. We modeled our space off of an emergency department. You can see where it's a big square, what they call the racetrack model. Our rooms are we have 6 rooms that are designed just like an emergency department. Our other 10 rooms are modeled after like a physician's office where you'd see a sore throat, things like that. We see a wide variety of patients. Anything from sore throat, minor rash, colds, all the way abdominal pains, chest pains. When our patients arrive, we don't turn anybody away. We will assess and see everyone. If the patient's not appropriate to be here in our department, we will see that they get transferred to where they need to be, whether that be the emergency department or ophthalmology or maybe surgery, someplace like that. So, and our athletic training students who come to the urgency care will be assigned to a provider. They'll work with that provider one-on-one basis. You'll see everything the provider sees. You may even be asked to take a patient history, go in ahead of the provider, and then come back and report to the provider. We see a wide range of patients here at urgency care, anywhere in age range from newborn all the way up to over 100 years old. We see a very diverse population of different cultures, different ethnicities. We try to create a culture where we feel like people belong. And for our patients who need interpreter services, we do have access to an iPad here in our department that has over 200 languages on it. This is one of our exam rooms that we have modeled off of the emergency department setup. As you can see, we have a cardiac monitor. We are able to do IV infusions, and we have stretchers in these rooms. The thing I want to talk about that our urgency care differs from your average urgent care. Here again, we have cardiac monitoring capability. So if you come in with chest pain, we're able to put you on the monitor, determine if you're having a heart attack, then you'd be transferred to the emergency department, or if it's safe for you to stay in our department. We also do IV infusions, which most urgent cares do not. We have our lab department here in our department, so our patients don't have to leave. The lab goes directly to them. Also, the entire time that we are open from 8 a.m. to 8 p.m., we do have access to diagnostic imaging to include CT, MRI, radiology. We have also access to ultrasound. We have a results nurse who will call all of the patients that have a positive COVID, strep, RSV, or influenza, and they do a ton of patient education over the phone on that and answer any questions that patients may have. All of our providers and nurses here in the urgency care are ACLS, which is Advanced Cardiac Life Support, and Pediatric Advanced Life Support certified. So we do have a crash cart with emergency medications, emergency airway equipment, and whatever else you would need for an emergency. We also are the department, if there's any kind of an emergency anywhere in the building, they'll page that overhead. We respond with our jump bag. We have an oxygen tank in there, equipment to stop bleeding, airway equipment, things like that for minor emergencies. We here at the Mankato Clinic are committed to helping students in the healthcare field, and we want to thank you for your interest in the Mankato Clinic.